Hello, my name is Benjamin Lake. I'd like to speak to you about my evidence-based project proposal. I did my project on virtual reality exposure therapy in the treatment of PTSD. So a little bit about the background and significance. PTSD is a chronic and disabling psychiatric disorder that may develop following exposure to traumatic events. The DSM identifies types of events with potential to produce PTSD which are directly experienced, witnessed, including actual or threatened death, serious injury or sexual violence, and repeated or extreme exposure to traumatic event details. In the past year, approximately 3.6% of U.S. adults will experience PTSD, with a higher prevalence of PTSD rates for females over males, and a lifetime prevalence rate of PTSD at 6.8%. This is according to the National Institute of Mental Health. The principal symptoms of PTSD present as concern, intrusions about, and avoidance of memories associated with the traumatic event itself. So a little bit about the theoretical framework used in this project. I use the title model as one that requires the provider to be genuine and authentic in their approach to facilitate care. The title model emphasizes an egalitarian relationship within which collaborative and empowering interventions have the potential to facilitate personal growth and discovery. Also, the title model's primary emphasis is on the exploration and development of the lived experience of the patients. So, as through the use of the virtual reality experience, the therapist can actually try to live or walk that experience with the patient. Um, Again, Barker, the creator of the title model further describes the title model as a metaphor. Life is a journey undertaken as an ocean of experience. All human development, including the experience of illness and health, involve discoveries made on that journey across the ocean of experience. The title model provides an approach where the psychiatric mental health nurse practitioner and the patient can walk or sail the journey of life together, whereby the provider can facilitate the patient's growth through active listening and utilization of the patient's resources and strength to guide this treatment. So a little bit about some of the supporting evidence. So virtual reality exposure allows tight control over multisensory stimulation presented to the patient, allowing therapeutic strategies to be precisely implemented. Virtual reality exposure therapy can stimulate situations that can be useful in providing therapy that would otherwise be impractical or impossible to recreate. This allows repeated modifiable treatments that increase emotional engagement and eliminate avoidance in the clinical setting. This whereby will habituate the patient to their memory of the traumatic event and reducing or eliminating the PTSD symptoms, including the avoidance. So 3 studies were used in creating this. So the first one would be Dang et al. In 2019 conducted a meta-analysis review to investigate the role of VRET as a therapy for patients with PTSD. According to this study, the main effects showed moderate effect size for VRET compared to control conditions on PTSD symptoms. Subgroup analysis revealed that the effects of VRET were larger when compared to inactive groups than active control groups. They further identified a dose-response relationship existing with additional VRET sessions displaying larger effects. Long-range effects of the VRET on PTSD symptoms also indicated sustained decrease at 3-month follow-up and again at 6-month follow-up. The second study was the randomized control trial of 108 active duty U.S. Army soldiers. These soldiers had PTSD stemming from the deployment to Iraq or Afghanistan. According to Nor et al., post-treatment, the virtual reality exposure participants had CAP scores 6.66 points lower than participants in the prolonged exposure therapy. So these results also indicated that patients predicted to see greater reduction in PTSD symptoms through the use of the virtual reality exposure were likely to be younger, not taking antidepressant medications, and had greater PTSD hyperarousal symptoms. They were likely to have greater than minimal suicide risk as well. Finally, the last study was included in this project would be the case study, and this is where virtual reality was used to augment imaginal exposure in a protocol based on prolonged exposure. So this gentleman survived a terrorist attack and developed PTSD, and so post-treatment, again, they used the CAPS to identify symptoms and measure it as being the treatment being effective. So There was a large reduction in PTSD symptoms with clinically administered CAP scores again dropping from 79 pre-treatment to 0 immediately post-treatment. Additionally, at the 6-month follow-up, the patient self-reported that therapy had helped him in many areas of his life, returned to full functioning, and passed to the site of the attack almost daily. CAP scores also remained at 0 at 6-month follow-up. So for this project, the outcome measures, this would be done use of the PCL5, is a 20-item self-reporting questionnaire corresponding to the DSM-5 symptom criteria for PTSD. This can be completed by the patients in the waiting room prior to their meeting with the psychiatric mental health nurse practitioner. This takes approximately 5 to 10 minutes to complete. According to the U.S. Department of Veterans Affairs, the interpretation of the PCL5 can be completed using the symptom cluster scores that correlate with the DSM. And again, so this is kind of what it looks like. Let me zoom in here a minute so you can see some of the questions. A little too far. Sorry, not as good as our teacher at this. But again, so this is just a little questionnaire that can be completed by the patient prior to being seen. So a little bit about the timeline or the implementation of the plan. So during the patient encounter, the psychiatric mental health nurse practitioner would offer virtual reality exposure therapy as an option for treatment based on the patient's PCL5 score. The patient would be educated that if they declined, this would no way affect their treatment being provided, and it's voluntary, and they might also terminate the virtual reality exposure treatment at any time. The psychiatric mental health nurse practitioner would educate the patient that all information regarding this project would be password protected and encrypted on an external hard drive, only accessible to the psychiatric mental health nurse practitioner and the psychiatrist. The patient will be provided informed consent, reviewing the treatment, risk, and emergency contact number. Patients that are physically unable to support the virtual reality exposure equipment would be excluded from this as it could pose potential risk. So a little bit more about the timeline. So treatment would include 30 to 60 minute psychotherapy sessions that would be delivered consistent with the published treatment manual for prolonged exposure. So except for the use of VR during this imaginal exposure. So the sessions would be scheduled every other week. PTSD symptoms will be measured as the primary outcome utilizing the PCL5 again. So this would be done at initial diagnosis and then prior to each session and at the 6-month follow-up. So here's a little bit about the references. And I appreciate your time in reviewing my project. Thank you.